evening, Michelle.
Good evening, Dr. Blessman. How you doing?
Hey, I am doing great. Absolutely awesome. I am so happy to be here. And so happy to welcome the participants to tonight's webinar, Zoom. Sure, I see Shirley's in the house, Barbara's in the house. Barbara, something should be coming your way soon through USPS. Belinda, hi Belinda, Sandra, Denise, Eddie Joe,
been a loan officer for 22 years.
Elizabeth Rose. Somebody needs to, okay, Felicia. Hi, Justin, back from London. Christy, Ms. Belvedere, Nia, Patricia from London, yay. Paula McNear, Rashida, Sharon, Sheila, welcome tonight. I appreciate you all are here tonight. I appreciate this community. It is certainly one of the ways in which—
Effie Brown is here.
Hey, Effie, nice to see you. Yes.
Don't forget about
me. How could we, right?
Thank you.
It's good to have this community, because it's also a part of how we cope. The sharing that we have with each other and just coming together as a community is a way for us to cope with this crisis that we are, this stressor, this ongoing stressor that is a part of our lives. It's no longer probably in the crisis phase, but it's good that we are here gathered together every Tuesday evening. I want to start tonight. That's my dog in the background. She making noise. She's telling me she's here. Every Tuesday morning, Rufus Williams has a show on WVON, and WVON is an iHeart radio station. And it is one of the major Black radio stations in the nation. I'm pretty sure you can reach it through iHeart anywhere you live. As long as you have access to a computer, you can reach iHeart. So on Tuesday mornings at 7 a.m. Central Standard Time, he talks about COVID. Rufus is a friend of mine. So we often talk about similar things or have similar themes for the discussion. So today he brought up something that I really want to share with this group before we get into the article that I suggested that folks read. And it's in line with the things that you have been discussing informally before I came on. How we're all weary and tired of this, how long this is going to last, what's happening. Folks are, some people are mandating, or some school districts, like here in Chicago, they're talking about whether they're going to make masks mandatory or not. Some districts will have mandatory mask mandates. Some other school districts won't, throughout the state of Illinois. And so there's a lot of things going on. But he shared something this morning that I think that I wanted to share with this group. And it's something about, what's the old saying that we have? If you don't learn your history, you're doomed to repeat it. So there was something from the last 1918 influenza pandemic and lessons from it that I think we could all learn from. This piece is by John M. Berry, who's a distinguished scholar at Tulane University School of Public Health and Tropical Medicine, and he's the author of The Great Influenza, the story of the deadliest pandemic in history. Most histories of the 1918 influenza pandemic that killed at least 50 million people worldwide say it ended in the summer of 1919, when a third wave of the respiratory contagion finally subsided. Yet the virus continued to kill. A variant that emerged in 1920 was lethal enough that it should have been counted as a fourth wave. In some cities, among them Detroit, Milwaukee, Minneapolis, and Kansas City, Missouri, deaths exceeded even those in the second wave, responsible for the vast majority of the pandemic's death in the United States and elsewhere. So most of the deaths happened in that fourth wave. This occurred despite the fact that the US population had plenty of natural immunity from the influenza virus after 2 years of infections and after viral lethality in the third wave decreased. Nearly all cities in the United States imposed restrictions during the pandemic's virulent second wave, which peaked in the fall of 1918. That winter, some cities reimposed controls when a third, though less deadly wave struck. But virtually no city responded in 1920 when the fourth wave struck. People were weary of influenza, and so were public officials. Newspapers were filled with frightening news about the virus, but no one cared. People at that time ignored the fourth wave. So did historians. Deaths returned to pre-pandemic levels in 1921, and the virus mutated into ordinary seasonal influenza, but the world had moved on well before. We should not repeat that mistake. Now, true, right now, we have every reason for optimism. First, Omicron cases are declining in parts of the country. Second, nearly the entire US population will soon have either been infected or vaccinated, strengthening people's immune systems against the virus as we know it now. Third, although Omicron is extraordinarily good at infecting the upper respiratory tract, which makes it so transmissible, it seems less able to infect the lungs than earlier variants, so it is less virulent. It is entirely possible and perhaps even likely that because of the better immune responses, the virus will continue to decrease in lethality. And 1918 virus might lose its ability to bind to cells in the lungs, all of which makes overconfidence, indifference, or weariness after 2 years of battling the virus and one another a danger now. Signs of weariness or misguided hope are everywhere. Although more than 70% of the adult population is fully vaccinated, progress has stagnated. And as of January 27, only 44% have received boosters, which provide vital protection against severe illness. And remember, only I think 40% of the African American population has had one shot, let alone second shot and boosted. So there's a large percentage of our community that has not been vaccinated. Although most of us, especially parents, want schools to stay open, parents have gotten only about 20% of children ages 5 to 11 fully vaccinated. As in 1920, people are tired of taking precautions. This is ceding control to the virus. The result has been that even though Omicron appears to be less virulent, the 7-day average for daily COVID-19 deaths in the United States has now surpassed the Delta peak in late September. Worse, the virus may not be finished with us. Although there's a reasonable likelihood that future variants will be less dangerous, mutations are random. The only thing certain is that future variants, if they are to be successful, will elude immune protection. They could become more dangerous. That was the case not only in 1920 with the last gasp of the 1918 virus, but also in the 1957, 1968, and 2009 influenza pandemics. In 1960, in the United States, after much of the population had achieved protection from infection and a vaccine, a variant caused peak mortality to exceed the pandemic levels in 1957 and 1958. In the 1968 outbreak, a variant in Europe caused more deaths in the second year, even though once again, a vaccine was available and many people had been infected. In the 2009 pandemic, variants also emerged that caused breakthrough infections. One study in Britain found a greater burden of severe illness in the year after pandemic but much less public interest in influenza. Researchers blamed the government's approach for that. In the first year, the public health response was highly assertive, chiefly in providing information. There was no lockdowns. In the second year, they found the approach was laissez-faire. As a result, a large number of deaths, critical care, and hospital admissions occurred. Many of these and otherwise healthy people of working age. Such precedents should make us wary. Vaccines, the new antiviral drug Paxlovid, and others could end the pandemic once billions of doses become widely available globally, and if the virus does not develop resistance. But the end is not going to arrive anytime soon. Let me say that again. But the end is not going to arrive anytime soon. The immediate future still depends on the virus and how we wield our current arsenal, including vaccines, masks, ventilation, the antiviral drugs, remdesivir, and steroids, and the one monoclonal treatment that still works against Omicron, socially distancing and avoiding crowds. As a society, we have largely abandoned those public health measures. As individuals, we can still act. Okay.
Well, that pretty much summed up what we're dealing with today.
Exactly. So, we need to clearly learn from the past and not repeat, those mistakes that was made in the past. By giving up, by becoming overconfident, indifferent, or being weary of following through on the protocols. We know that this is going to be at least a 3 to 5 year process, at least. And there may be some things that may not ever return to the normal that we had prior to this pandemic. It may be a while. How this pandemic we're in, if Paxlovid works and we have an effective treatment, meaning something that will kill the virus in our bodies, that's an effect, that's a cure, something that kills the virus in our body. Once that happens, then we can talk about this is the end, but that hasn't happened yet. Okay, right now, all we have are treatments that can give us symptom relief. Remdesivir a little bit stops the, it's a drug that they use to attempt to decrease the replication of the virus in your body, but it doesn't kill the virus in your body, but it does help. There's only one monoclonal antibody treatment that actually is effective. I think they had like 3 or 4. So despite the fact that that we are experiencing COVID fatigue and it's hitting hard, we're gonna have to figure out what we need to do to hit hard back and to stay motivated to continue to do what, to continue to use our PPE, to continue to use the biosafety strategies for the next year or until COVID actually ends. And like I said, the way that we know it ends is when there's an effective treatment. There's an effective treatment that will actually cure COVID if you have it. So what we're dealing with now, we're talking about the abnormal becoming the new normal. We are dealing with, an ongoing stressor. We're tired of being cooped up. We're tired of being careful. We're tired of being scared. Our collective fatigue is making more people careless. And that coupled with, a highly contagious variant has contributed to the sharp increase in COVID. Even though, thankfully, infection rates are decreasing. Remember, they're decreasing because we're past the holiday season. So, we need to take a look at, how we're addressing that fatigue and how, we are keeping ourselves armed up and suited up and booted up. That's a real challenge. Okay, everybody got real silent. Even the chat is silent. So I'm gonna keep going. Abnormal is the new normal, but that doesn't mean we have to keep to ourselves. It starts with understanding why so many people feel frazzled. Knowing why we feel that everything is abnormal can help us feel normal. We know that there are two kinds of stress that have long-term effects on our mental health, well-being, and physical health. Intense stress and prolonged stress. We actually have both. Intense stress is when somebody in our family or are close to us gets COVID, because now we're in the midst of that crisis. Prolonged stress is that we're all dealing with the change in our behaviors, the things that we need to do. We all know that, changes in for parents particularly, they're dealing with, 1 week their kids are in school, next week somebody gets COVID in the classroom, and now everybody has to be quarantined and they're back at home. Or, so there's prolonged stressors that are going on all the time as we deal with this pandemic in the course of it. And then if you add to that uncertainty, because it's not like, this is going to be predictable. Parents don't know it. It's not predictable when their kids might end up having to come home and be quarantined for the week. Or somebody at work comes down with COVID, and so the whole office has to shut down. Or cases, spread, spike in your city. And so, new mask mandates or new mandates are put in place. Municipalities might put in new mandates. So, so you have to, when you add in the unknowns, the uncertainties, and the fact that we have both prolonged stress and intense stress going on at the same time, that's challenging. It's challenging because in a lot of ways, it's hard to plan your life around events that may change. I for example, have a trip planned to go out of town next week. I'm hoping, keeping my fingers crossed, that I will be able to go on that trip. I usually am already planning for whatever trips I'm going to take over the summer. I can plan them, but I've got to be ready, to think about, okay, how much money am I willing to lose if COVID happens, in our family. So in some ways, planning, and particularly long-term planning, becomes challenging. I know when Michelle was thinking about going on her trip, she was like, okay, I hope, well, first of all, she had to worry about the weather, whether a plane was going to arrive or, be safe, but also, what's happening, in terms of biosafety issues. There are stages around disaster stress. So, in the beginning, the researchers have found that there are stages of stress on communities from disaster. Early on, during or right after a disaster, communities tend to pull together. People support each other and create a sense of community bonding. Think back to the first weeks or months of the stay-at-home order, when everyone in the neighborhoods waved to everyone else. Remember, we used to have special things that we would do for the nurses. I remember in my community, I live in a community where there's a lot of high rises. We would do at night, as soon as night fell, there would be people would come out and sing, or they would ring things, to support the healthcare workers. And there were all kinds of neighborhood and community support that we were doing to each other to uplift each other's spirits. Not happening now. Okay. And so, that's about where eventually the heroic spirit wears off and wears thin as the difficulties and stress build up. That's when we hit the disillusionment phase. we lose our optimism and start to have negative or angry reactions. We ask, what are they doing to fix this? How long will this last? And the hardest, one of the places where you can see this the most is really within the hospital system. Because I have a friend who's director of nursing for Advocate Care Hospital here in Illinois, and the Atlantic just did an article about their hospital and what is happening to the nursing staff and to healthcare workers in the hospitals, in this hospital in a Black neighborhood where they've just been overrun with COVID cases, and the nurses themselves are just so fatigued and so weary of what's going on. They have, where people are having 10-hour waits just in the waiting room, where people can't get a bed for 2 or 3 days. It's and they talk about how they can't see this becoming the new normal for them because this is unsustainable. They're also talking about how a number of nurses have left. They're working with short staffs, that they've had to hire, instead of having registered nurses on the hospital floor, they've now had to lower the standard and hire in LPNs and use the registered nurses for supervision. Well, what that means is you're going to have a different quality of care. It's in the Atlantic magazine. If anybody wants a copy of the article, I can send it. Put it in.
So, Dr. Blessman, I experienced that last week with those clinics. So my provider was not a physician, and neither was she an RN. Mm-hmm. She was an FNP, and she still, I guess she can use her degree interchangeably. But, we had maybe 6 patients a day for 5 days. I'm grateful and thankful that I didn't have to go into the clinic on Thursday and Friday, but Monday, Tuesday, and Wednesday, you can best believe at least 80% of that patient base was COVID, were COVID patients.
So, yeah. So as we, we can't afford, we personally, I don't, when people ask, well, what's the point of doing all this biosafety stuff? Reason why you want to do it is because you don't want to be in the hospital right now. That's, honestly, so those folks who are going around saying things like, well, I don't care if I get COVID, I might as well get it. I don't care. That is defeatist thinking, and we're not. And I don't think we should accept that.
Right. And then the science is still saying, as I read these articles while you talk, doctor, like one of the themes that's jumping out at me is that these scientists still don't know what this virus will and can do.
Right.
Michelle, that is the whole thing about all of this. Everything that we're doing is we're living in the unknown. And until people realize that they have to practice some biosafety protocol, because I'm sure y'all know that even Dr. Rowland caught COVID. Did y'all know that?
Yeah, and that one I would chalk up to overconfidence, and he,
yes,
and
yes.
we and I've gotten on this case about because he was not strict about even his practices. I said, wait a minute, you were there and you didn't have a mask on, and what's up?
Exactly. I mean, it's like we cannot let our guard down. I am a trained scientist. I mean, I do not use my science degrees. They use my degrees for my analytical skills in the government. But this virus right here is outpacing science. We don't have the knowledge or technology to understand this. This is beyond us. So if you're operating in the beyond, you better do something to try to protect yourself. And it's like, I just don't understand people that say they're not gonna wear masks. I don't understand people like me and my friend were talking this morning, and it was a lady that her child had asthma and she refused to put a mask on the child, and they had expelled a girl from school like 3 times, and she was walking in the rain to put her kid, and this was somewhere here in Virginia, to take her to school, and she was like, well, I don't want to put her mask on because she has asthma. That's all the more reason that you should have a mask on. So a lot of the stuff is just pure stupid ignorance that people are not listening to valid resources. And like you and Michelle brought up, Dr. Blessman, this is the only group. It's a lot of groups I follow, but this is the only group that tries to tell us anything to try to preserve and save ourselves.
Right.
Dr. Blessman,
Right.
this is Dr. Blessman, this is Effie. I have my granddaughter goes to a Christian school here, and they were supposed to go on this field trip next month in Alabama. And because the people from I think it's the Space Needle place that they go for this field trip. Anyway, just because they had to wear the mask, they canceled the field trip. And
Wow.
I just, when my daughter told me, I just could not believe it, because even at the school where she goes, they're not doing the mask at all, So yeah, they canceled it because the place said you have to wear a mask.
Wow.
And that's something.
That's pretty crazy.
And Miss Effie, that really says that people are stupid, because what they don't realize is this virus is going to make it so bad. They're fussing about wearing a mask, but do they want their kids to have an education, or do you want to kill off all of the teachers, kill off all of the medical staff? Then where are you going to be because you so stupid?
Yeah, I just couldn't believe it. I told my husband, my son-in-law, they just, shook their head. Who would do that?
Stupid people.
They canceled the trip because you had to, if you come, you got to have your mask, and of course, so I wanted to go myself.
Yeah. Somebody
screamed. So Dr. Blessman, are we like such in like denial that we are so overwhelmed that people are just not making logical sense anymore? Like I said, the lady with the asthmatic daughter who was sending their child to school and she doesn't have a mask on. I mean, it's like this stuff is like illogical. So I'm like, is this affecting people's psychological health?
I think, first of all, most of us don't have, this is, one of the first things I did was I started looking up and getting research on the 1918 pandemic. I went to the past to see what did people do back then to cope. Most people just haven't, this information is not being widely disseminated, whether it's information on biosafety, whether it's information about learning from the past and from past pandemics, learning about, how people psychologically respond to pandemics. What can I say? I don't know that, and I think that people have, varying degrees of being able to handle a long-term stressor like this. Not everybody can, most people are able to, well, I don't say most people, some people are able to recuperate from something if it's going to be like 3 to 6 weeks or whatever, something that's quick or, whatever. Even in just in terms of working with people who are gone through particular kinds of crises. I've talked to people who have had a stroke, or people who have had some kind of injury or something that happened to them. And I would talk to them about, don't be surprised if you have people that will come in your life and they'll be there, you know, first 6 weeks, you know, they'll be there, they'll be supportive. And after about 6 weeks, people will fade away. But you have a situation that's going to last for years. You're going to need help for years. And understand that maybe it'll be about 3 years before you get to a new normal. We are in that situation. We sort of ran through that when HIV hit. Remember, you know, I don't know if how many folks here are like 60, maybe about 60 or older. When HIV first hit, you know, that changed dating and sex lives dramatically. And it was about 3 to 5 years before a new normal was developed in terms of how you approach dating, how you approach, you know, dealing with your sexuality, you know, or what have you. People are not necessarily geared to deal with long-term.
Well, Dr. Blessman, I'm gonna push back because I'm gonna push back just a little bit.
Understand, you're about 10 years younger, so when you okay, but in 1980, see, it's one thing to grow up. It's one thing to grow up with. It's one thing to have it a part of your life all the time.
Right.
But in your 20s, and you had to change like that, literally like that. You had to change overnight.
Okay, so right. Okay, so
that's the difference. So if you were like even 10 years younger, you grew up with that.
mm-hmm.
You grew up knowing that, okay, you were coming into your sexuality knowing, okay, I got to be careful. You had more time it was already there and there for you to adjust to. But if it just hit like, because I remember when it first hit, first of all, people didn't even know what it was. I mean, all the phases that we're going through right now with COVID, we went through the same thing in the very big, for those of us in our 20s. And it's a loose metaphor. It's a loose metaphor. It's not a perfect metaphor or a perfect analogy. But what I'm trying to say is that people have a harder time. Some people have a harder time with a long-term stressor, something that's going to take 2, 3, 4, or 5 years. We're in our second year. We're going into our third year. Actually, March, I think most of us, lockdown started happening around March 17th. So I kind of count like March 1st is sort of like the beginning of the third year. We are fast approaching the beginning of the third year. And it may be, it is definitely going to be at least another year before we know for sure that Paxlovid even works, because they're still doing the research on that.
But now, so, you know, Dr. Busman, in reference to the wave of HIV, right? So because it was primarily in the white gay community for so long, I think that even in my younger days of being a little wild, we weren't so concerned about catching HIV, right?
Exactly. And that's and you know what? When this virus first hit and it was in the Black community, there was a whole lot of unconcern because it was just hitting Black people. Same kind of response. Okay.
Well, it came
a loose analogy. I don't want to get caught up in the HIV.
Yeah, no, I'm saying how it evolved, right?
So here we are 40 years later. You know, now we've got medications for it that makes it undetectable inside of a person's body. But it took 40, it took, I don't know, 30, the drugs have been out for maybe, that level of drugs have been out for, I think, the last 10, I believe. But, it took 30 years to get to some kind of semblance of a new normal or different, So I don't know how long it's going to take for this virus, this pandemic, for there to be a new normal for this pandemic. It's when you look at the ones that happened before, it was at least 3 years. Okay, at least 3 years. And so we're just at the end of year 2, but it took at least 3 years, if not 4, to get to some kind of new normal. And I think that people, I think it's important that people recognize that and know that. So we may be doing this, folks, for the next, at least maybe another year or two.
Depending on
Dr. Blessman, I think that we're going to be doing this a little bit longer than that.
I do too.
Because the problem is that now you have politics and people so into making an economic profit off of this. It's going to be around. And just like you're saying, you gave, we're not going to go to the AIDS thing, but 40 years to develop a drug, that's a lie. And me as a scientist, I know that. I have done testing for drugs, like anti-cancer drugs and stuff like that. That is a lie. It's from the epitome of hell. They do not tell y'all the truth. They have these drugs, just like we have cures for cancer. And we know we have cures for cancer, but we don't publicize them, because if we can profit off of it, I mean, let's just be real. The medical community profits off of keeping all of us ill. Mm-hmm. So if people are not listening and you're dying, or we can sell you high price PPE, which is good, we are still profiting. And it's like, when are our people going to wake up? And I hear you, Michelle, saying your circle of friends won't listen. Well, I do too. Right. I belong to the 100 Black Coalition women, and right here in Virginia, and it's a big community all across the country. Mm-hmm. But a lot of them, I just fussed them out one day, and they thought they were going back in-person meetings. I said, y'all can go anywhere y'all want to, but all of y'all old and older than me. I was like, I'm not being rude, but y'all don't have the proper PPE. And they did not believe me. And I'm just like, I can't do it, and I don't understand, because y'all are supposed to be educated. Mm-hmm. And I really just don't understand. What part do y'all not understand about this disease will kill you?
Well, see, that's the thing. That's the thing. And I think the point that I was trying to make in this is that, yes, the drugs are there for HIV, for the treatment. The problem is access.
Exactly.
So even if you get, so you talk about COVID, you want to put this in the umbrella of COVID fagitude, right? Like, we really can't get tired. We really can't get fatigued. Like, we have to be soldiers in this.
You do.
Standing up, creating a standard, creating a standard for people to follow, because if our resident scientist is in the room with us, who hasn't been with us, I'm gonna, just put her on blast because she's so well informed in that community. If the scientists are saying, we don't know what this thing is gonna actually do, then we can't get tired, right? What our way of life, or the way that we create our normal, will have to be allowing COVID to be the elephant in the room, and dealing with how we, contain it, and let that be part of our norm, so that we won't be stressed out about the next, because see, the next thing is out there, right? Like, I'm reading articles while doctor is talking, and the next thing is out there. And so how do what's stressing me out really is that the further away we get away from the Wuhan strain, the less information we have about what this thing is actually doing. Like, it's not, the death toll is not up there no more to keep you vigilant, right? Like, they don't show that no more. That's a downer, that doesn't sell. Then you got to hunt for the information, right?
So Michelle, we need to look at this just like that. All of us, mostly in this group, we're Black. We live with that every day. We face racism every day, most of us in our jobs, and we are soldiers. We have been soldiers since the beginning of time. So we need to get over our pity party and start doing what we have to do, and just keep marching on. It's the same thing as us wearing our Black skin every day. And that's basically COVID is here to stay. It's going to be around a while. I've even heard other doctors like Dr. Rowland say that, like virologists and stuff like that. So it's like, you know, just accept it, do what you can to prevent it, and just like kind of move on. It's not going anywhere.
And that is my attitude, because it's really about changing your behavior and accepting what you can't change. So if you can't, we have no tools to change it migrating, mutating, but we can change ourselves.
Right.
So I'm doing everything I can to not even function on what it's doing, because it's invisible. So I don't even know when it's next to me. I'm just trying to be responsible for what I can do to protect myself. And trust me, a lot of my friends, my very close friends, they don't want to hear anymore. They don't want to ask any more questions. And at first I was a little put out. But you know, I came to the conclusion that you can't force anything on anybody if they don't want to do it. So, you know, what about just trying to protect myself first and the people around me who want the information? That's all we can do.
That's the only thing we can do.
And just try to stay positive as we figure out how to navigate from month to month, from week to week. I mean, I don't even feel comfortable planning anything six months out.
Because you don't know what it's gonna look like.
We just don't know.
Miss Paula has a comment in the chat, and it's interesting that you put that there, Miss Paula, because in Indiana, where I was at last week, there was an oxygen store right in the community for the people. I was like, well, dang, if they needed some oxygen, all they got to do is just go to this little store right here because it has oxygen. But you have to know the little city that I was in was 99% Caucasian. And so, you know, I have yet to see an oxygen store in Montgomery, Alabama. And so does it make sense to purchase oxygen? Well, if you have someone who is struggling with oxygen, you might want to get an oxygen tank. I mean,
well, according to Dr. Rowland, when he got sick, and y'all can go look up his YouTube video, he's encouraging everybody to get an oxygen tank just if you get sick, because he said he could not breathe.
I have something better than that. So how about go get a sleep study and then let them prescribe you a CPAP. And you learn how to sleep on it every day, which is what they're going to give you a BPAC if you go to the hospital and you can't breathe with COVID. So why not already have it and learn how to sleep on it? So when you get there, or if you get there, you won't be taking it off like a lot of people are doing at the hospital. And as they continue to take it off, then they move it and give it to the next patient because they're not keeping it on. And I know that for a fact.
I have a question now for a sleep study. I mean, in order to get that, you'd have to have a problem for that, a medical problem before they even give it to you.
Or your physician can just refer it, or your physician, you can ask your that's why it's important to have a relationship with your primary care provider.
But there would be they would have to have a reason to give you a sleep study.
Yeah, they have a diagnosis for that.
Yeah, you can have insomnia. You don't sleep at night. You don't sleep well. You don't really know what you do when you sleep.
Right.
You have a headache.
Yep. Headache.
Don't put them that way. Okay.
You have a breathing problem. You know, you're waking up in the middle of your sleep and you're coughing. There's a lot of things you can say to get a sleep study.
Yeah,
that's enough. I snore.
Quiet yourself for about 2 hours. You come up with a lot of stuff. Just quiet yourself while you sleep. And then you'll discover what you really look like while you sleep.
Mhm. So, my thinking about getting tank is this. If you are unvaccinated
Mhm.
and you get COVID, okay, first of all, you're at much higher risk of hospitalization or death. So the next thing you need to think about is the community you live in and the hospital that you're closest to and how full they are. Because if you were to get COVID and if you were to start having breathing issues
Right.
and you had to be in the waiting room for 10 hours,
Mm,
and it'd be 3 or 4 days before you get into a hospital. Because they're talking about what they're like I put the article in the chat, the hospital advocate care, where they were having this influx of COVID patients and overrun. They were trying to give people oxygen in the waiting room and didn't have enough oxygen tanks for everybody. I mean, it's a real graphic description of what that hospital was facing and what people were experiencing when they got to the hospital, to the emergency room at this hospital. So you have to take a look at your specific risk. If you are unvaccinated and the hospital next to you is crowded, like really, really like swamped, overwhelmed with COVID patients, and you have a breathing problem, you may not be able to get to an oxygen tank fast enough. If your oximeter reading goes under 80, and so the thing about when your oximeter levels start going under, particularly when it started going under 90, but particularly when they start getting 80, your physical health can change very quickly, very quickly, like in 4 hours. It's like you need to be on oxygen right away and have a source for oxygen right away. You can't wait 3 or 4 days. You might not be able to wait 3 or 4 days for a head to get consistent oxygen. And your emergency room might be filled with patients or filled with people trying to get in, see somebody for COVID related illness, and you may not have access to an oxygen tank. Now,
right.
I don't know what anybody's specific situation is here in this Zoom. You have to take a look at your specific situation. I know in my household, before COVID even started, my husband has a CPAP. So we already know that CPAP is going to be called into use if one of us gets COVID, okay? I think there's companies that can provide you, if you are unvaccinated, you need to know where you might be able to get oxygen quickly. There are companies that do provide oxygen and rental tanks like 24/7. So you need to have that on, you need to know where you can access it. I don't know that everybody, I don't know that everybody needs to have an oxygen tank in their house per se. I don't, that's a bit much. But I do think that you need to know how you can access it depending on your health, depending on the hospitals in your area. So I know where I live, I'm not worried about it. And plus I have a CPAP machine. So I'm not necessarily worried about it. I'm not worried about it for people in our building, because we have like Shirley and I both live in the same building. We have like within our neighborhood, we have 3 really high level, top of the line hospitals very close by, and none of them are overrun, I don't believe at this point, with COVID patients. So I'm not so much worried about that. But then that's my individual situation. I don't know, I can't speak to your individual situation. And that's an assessment you will need to make. You want to be someplace where if you needed to get oxygen in the next, if something happened to you. I mean, first of all, you're going to have COVID, number one. So the moment you get diagnosed, there are certain things you need to know. If you're going to need oxygen, where are you going to get it? And there, like I said, there are organizations or companies that provide oxygen tanks 24/7, and they can have it to you immediately. But I don't know that service is in your area because I don't know where each of you live. So, but that might be a piece of research that you may want to do for yourself after this phone call, is to go take a look, look up oxygen tanks, portable oxygen tanks, 20, that you can get within 3 or 4 hours. Because you might need that. And there's nothing wrong with having that on, having that company on speed dial in case you or somebody in your family needs it.
So one of the things that I did was I sit down with all of my siblings, there's 5, and told everybody to go get their primary care, to refer them to a neurologist. Because if you go to a neurologist, which the neurological system, they're going to be more aggressive with getting you in a sleep study or trying to find out what your issues are. So all of us, all 5 of us, have a CPAC.
There you go.
So
and insurance pays for that, correct? I know insurance pays for my husband's.
yeah, insurance pays for it. All you have to do is make sure that you use it on a regular basis for at least 2 months.
Right.
Because they're monitoring if you got it and how you're not using it. So if you're using it, then at that point, it's a wash. Yeah.
Yep.
But it also does other things. I mean, it helps you to have great quality sleep where you don't feel sleepy in the daytime. You don't need naps.
I need it.
And I mean, it's added a lot of quality to all of our lives because we were all snoring. But you could die in your sleep if you're not getting enough oxygen.
Right.
Through your system. But again, and I didn't know I was snoring. My brother didn't know he was snoring. So
what's the requirement? You must wear at least 4 hours every night?
I think it's more like 5 hours every night. And it's not every night. Let's just say if you have 30 days in that month, probably 26 that first month need to be where you're using it. They want to see the activity. And they want to make sure that you are going to utilize it.
Correct.
And they're monitoring you at that point.
Right.
So,
right. Miss Belvedere has had her hand up and raised it up several times. I want to make sure she could get in there. Did you want to jump in there, Miss Belvedere?
Yes. Good evening, ladies and everyone on the chat.
Good evening.
Being that you're speaking of an oxygen tank, can you obtain one without a prescription? Can you just purchase it? And how would you know how to use it if you never used one before?
Hey.
Good question.
That's a good question because I've never had to order.
Let me check.
I think you have to have a prescription, but I do know that, in the hospital, when they do start you on a nasal cannula, they usually start you at 2 liters, and then you have a respiratory therapist come check you, and they determine, how much oxygen you need. So I don't know if it's a standard, amount of oxygen you should take if you're just ordering for yourself, but they normally start you at 2 liters and 4 and 6, and they go up depending on your individual case. So I guess if I had one at home and didn't have a prescription, somehow I'd start at least 2 liters.
Well, how is that? I'm sorry.
You can buy one.
You can purchase one without a prescription?
Yes.
Okay, and where's that?
Let me give you a good website for it because it's different.
Last week we showed a couple of Amazon had tanks, and also the canisters.
Miss Daddy, do you still have the links for that?
No, I just went to Amazon and typed in the I forget the name of that one, Enzo or something like that.
Okay.
But I typed in that one. That's the one that just takes oxygen out of the air.
Mhm.
And it cost, I think it was somewhere around $300. And then it was $130 if you were a Prime
I
business,
remember. Okay.
a Prime business.
Prime business. Okay.
Right.
Yes, sir. I remember that conversation from last week, and this is what raised my question as to purchasing a oxygen tank and not knowing how to use it or administer the proper amount, and for the length of time. I would not know those things. Can anyone address that?
You
Well,
need
I
a
think that if you bought it, they would have some kind of direction for use, right? Because I think that's regulated by OSHA. You just can't, you know, then the directions could say, consult your physician. But so, you know, let's see, here's one for close to $800. And it's pretty much telling you, it's saying what it's for. So like I said, I would think that it would have some instructions. But Ms. Belvedere, I know you have a primary care provider, so you can, if you bought one of these, I would just ask my doctor. And sometimes, you know, when I want more chemistry knowledge, I inquire of the pharmacist, depending on what it is that my doctor is treating. Because sometimes they just, you know, pull a prescription out of the hat and hope it works for you.
Right.
But then you go to your pharmacist and you say, hey, what is this? And what's, you know, and they're more, and they can give you more of a chemistry, you know, consult, more so than your provider. So, I mean, I wouldn't be afraid of purchasing one without a prescription, and I'm sure you can get what you need, or the directions of how much oxygen you should be inhaling every night. But I would start with my doctor first.
Okay, well, thank you so much.
Purchase it from a medical supply store. I'm sure that they can show you how to use it.
Yep, them too.
And they probably sell it too.
Mm-hmm. Most of them with the medical supplies, they really want to do a DME because it's more money for them. But I would still, you know, inquire.
I will. All right. Well, thank you so much for that, because I did ask my neighbor who's a PA, and she said, oh, no, you need a prescription for that.
Mm.
And I said, all right.
Yeah, she's a PA.
Nope, it's on the internet that tells you don't need a prescription. You can buy all kinds of oxygen tanks. This is a new world. They used to
Thank
control that. They can't control that anymore.
No, they can't.
Thank you.
And maybe your PA said that because they didn't know.
Right,
So
the
PA.
PA.
You know, so anytime anybody tells me anything, first thing I'm gonna do is go Google it for myself.
Mm-hmm.
Okay. All right. Well, thank you, ladies.
You're welcome.
And Mr. Eddie Joe.
I know, right?
I think the issue may not be the tank, but it may be the oxygen itself. You can buy a tank, but I think you have to have prescription for the oxygen.
For the oxygen. Now that could be maybe. Maybe. I don't know.
Oh, so it's like two different things, the tank and then the oxygen?
Well, see, I have to question that because they have oxygen bars. I don't know. Let me see.
I have 2 cans of Boost oxygen. That's a can of oxygen for runners. If you're running or hiking and you get winded, you can take this Boost and and pump oxygen, you just suck it into your
Supplement, yes.
Yes.
Okay, but how long can you supplement? I mean, does it like last for a few minutes? Is it like, can you be on it for an hour?
Oh, I don't think so. I don't think it. Yeah, it's just something for runners, and this came up long before COVID, and I just happened to purchase some because it was on Shark Tank, and I said, okay, let me try this boost oxygen. But I mean, I don't think it's for anything serious like a health issue when you can't breathe and COVID is attacking your lungs. I don't think that's going to work because you have to be able to, I guess, suck it
I
in.
think when you order those tanks, it's gonna ship empty because you have to remember oxygen is something that is volatile. So they cannot ship it to you with oxygen in it. You're gonna have to find the people that actually fill or have oxygen to fill that tank for you.
Oh.
Yeah.
Yeah, so
I'm looking at the ones on Amazon, they're empty. You
Mhm.
have to remember that a lot of stuff, and some pharmacists, I see somebody put a comment, yeah, the pharmacies do have it,
Well, they
but you
got
might
it.
need a prescription there.
Mhm.
Yeah, a lot of the pharmacies do have it now.
Mhm.
Medical supply stores, they have them that are probably already filled, but if you buy one like on Amazon, I was just looking at it, it comes empty. So
Mhm.
you're gonna have to get someone to fill that for you.
Yeah.
Okay,
So
and
you
maybe
do need a
that's where the
prescription.
prescription comes from.
The DME too. I mean, you can get the DME, the apparatus on a prescription. But yeah, this is it. You have to have a prescription for the oxygen itself.
Okay.
But I mean, shoot, you can buy medication without, if you don't have insurance, but you still need the prescription. Yeah. So there shouldn't be no reason why your physician wouldn't write a prescription for oxygen. It's not like you're getting oxycodone. So I want to share this with you, the community, before we wrap up. So it's interesting how we as African Americans live our lives, right? And it has everything to do with the harm that has been subjected to us. We can't help it. It's called post-traumatic slave syndrome. It's in our DNA. So we just kind of look at the world with a different lens. And even though we take the time to talk about what's out there, and as Ms. Shirley say, I can't see this virus. Well, we can't see, we know that deep down inside there's parts of us that is actually internalizing what is happening to our community, our family members, friends. People are still dying, right? Our friends are still being intubated, whether they talk about it on the news or not. So our community just approaches this pandemic different than others. So I was having a conversation with the nurse practitioner of the clinic I was working in, and I asked her if she had been vaccinated, and she said no. And both she and the medical assistant had COVID over the holidays, and they struggled with it, but of course they came back. So I was trying to talk to her about Novavax, and that it wasn't an mRNA vaccine, that it was a protein-based vaccine, and she just kind of, hesitant to really talk about being vaccinated, because what she said was, there is an organization that we don't know about paying $30,000 for unvaccinated eggs.
Eggs?
Unvaccinated
human eggs?
Women's eggs that can be fertilized with unvaccinated semen.
Is she talking about a clinical trial or something?
Wow.
Well, it's not necessarily a clinical trial. If you were,
These people white, Michelle.
of course.
Okay, so it's only something that they're done behind to come up with somebody being unvaccinated, because none of us know what the vaccination is going to do to us. So they say I'm retarded. And this is what I always say to people when I used to work with the military. We inject them with everything anyway. So what difference does it make? Their kids are already injected, and how many of them are their spouses were military? They're veterans. They need to get over that craziness.
Sounds like some QAnon stuff to me.
Well, it's not necessarily QAnon. And I think that, you know, again, there's another, and I'm not going to even say that this is an alternate world or discussion or QAnon or anything. What I'm saying is there are clinics, fertility groups who are paying women $30,000 for unvaccinated eggs. So they have a reason to continue to not be vaccinated, right? This particular lady, young woman, she has some biosafety protocols. That's because she works in you know, has contact with patients who are presenting with COVID every day. So her viral load, you know, could be so overwhelming that she can get this virus and actually die from it. But because she is fully aware, right? Because we had a great conversation. She is fully aware of the antibodies not lasting forever. So it's not out of ignorance that she is not deciding to get vaccinated. It's because there is a financial you know, benefit.
So Michelle, I Googled that as you're talking. So Johns Hopkins, and there are many medical facilities apparently across the United States that they pay anywhere from $3,500 per cycle, exceeding $50,000. So again, this is just America at its best.
Yes, so this is more mainstream than we thought, right, Ms. Watson?
That, I mean,
John
that's
Hopkins.
just who that John Hopkins is. It's just who we are. It's like,
yeah,
we're not concerned about human beings. Everything is about a dollar.
Really?
And it's like, for the love of money is the root of all evil. So she would risk her life so that she can have or get paid for these eggs, and still might come down with COVID when she's giving birth to the baby.
Come down with COVID and not even make it through full term.
Right, and it's not even her. Well, see, that's the thing. She's not.
I wasn't gonna say that part, but yeah.
Yeah, so she's not producing these eggs. She's not selling she's not giving up her unvaccinated eggs for another baby. She's giving up these unvaccinated eggs for someone else to have a child.
That just sounds like just too much for me. I mean, I love life, and I don't know that there is a dollar amount that I can put on for my life. Now, some people may feel differently, and they're entitled to do whatever is best for them. But I mean, if they can't listen to nothing about biosafety, I don't want to hear nothing about those eggs. I mean, to each his own, you know what I mean? And she's in the hospital working.
We're in a clinic.
So did you ask her, have she already done it, or is she just talking and reading about it?
No, this is something that's being planned to do.
Okay.
Mm-hmm.
Keep in touch with her. I want to hear how it worked out.
Yeah, hopefully I'll be
Google and read the stories. It's not just white people, it's Black people. I found a 27-year-old girl that made $18,000 for donating the eggs, and she used the money to pay for college. Okay, so this is just America at its best. We
She got
everything.
She got 18. They're looking for you know, 30,000.
They're looking for 30 and 50 and upwards of 50.
Exactly.
But what I'm saying, you know, it just shows America free enterprise at its best or its worst, however you want to term it.
Of course, and that's why we can't really get to a place where we can at least calm this virus down enough to try to get some.
We never will. But I'm like Miss Shirley. It's like there is no money that is worth my life or contracting COVID that my lungs are going to be damaged for the rest of my life. And then if I have underlying health issues, it's going to be worse. It's like some stuff. Are you willing to sell your soul to the devil for $1? You have to ask yourself that question.
No, I'm not gonna be selling my soul for no dollars.
I'm just throwing it out there. I'm just saying now. Come on now.
But I thought it was just interesting how, you know, if you are in a different environment or climate where no one is really respecting this virus, they're not masking, they are, you know, living their lives on life's term, how they are not, you know, sitting in a room in a community talking about how we all can stay safe, where they're more or less thinking about how they can sell their eggs for $30,000. So yeah, facts.
But what I do know is I saw enough people who were so close to dying, and they said, can I please get the vaccine? I wish I had taken the vaccine. So you have on both scales.
Well, when you
I think sometimes when any of us are facing death or we're waiting for death to come and get us, we may feel differently.
It's just unfortunate that you get to the point where you're asking for a vaccine that is not going to help you stay or die when you are being intubated because you can't breathe. You know,
because you were too stupid and you were too stubborn to listen to what people were telling you before it got to that extreme.
Exactly. So what the scientists are predicting is that at some point we're all going to get COVID. You know, that it is almost inevitable. I don't know how much of that I believe. I don't believe in the all theory. I think that if you are really vigilant, and that even drills down to the grandkids, the babies, if you're really vigilant and making sure that you are aware of your situation, right? So it's having keen situational awareness that this virus can be avoided. But so the fatigue, I think that is always good to address your feelings, to be in touch with them. And so if you are tired and restless, be in touch with that, but then you don't stay there. Make it your sounding board or your foundation to continue to use your biosafety protocols. I can tell you, Dr. Blessman, Justin, in my community that I traveled to Indiana, but I had 2 stops going. I had to stop going and I had to stop coming. And I was vigilant with my biosafety protocols. The planes were packed. I made sure I had my Living Guard mask on, as well as my ionizer. I had confidence in my ionizer. It was going strong, so I didn't pull out my air cave on the plane. But while I was eating by myself, I did have my air cave on my table, and I did take my air cave to the clinic. I used my Skin Guard and I used my Clean Smart while I was in the clinic. I have been home since Friday and I feel good. So I know the products work. I know I was in Walmart. There was a snowstorm, so they had encouraged me to go to the grocery store to get some things because I would be held up in my hotel room for a couple of days, and I was. So I went to Walmart in the community. Everything was on one street, one main road, the clinic, the hotel, and Walmart. So the experience was different. No one in Walmart in Marion, Indiana had on a mask. No one, nobody, except for the people who worked at Walmart. Not one. I was wearing mine. I don't care what they say, but no one had on a mask. No one. It was scary. I was uncomfortable. Really, it was. But I was.
Why were you uncomfortable, Michelle? Because you can be fine as long as you have a mask on. They're gonna be the problem.
Right, but I live in a community, Miss Christie, where people wear their masks. I mean, the oddball is the person that doesn't have a mask on. So it's coming from one culture to another where no one is respecting the virus. I was like, whoa, don't touch me.
In Virginia, we live in mixed cultures, and here in Northern Virginia, so we have white and black. So a lot of times you see a mixture of people with a mask on and you see a mixture without, but you tend to see more people with masks on.
Mm-hmm.
We even had where the lady, the governor of Virginia was in the store meeting with people. Everybody else in Alexandria had on a mask, and the lady told him, said, "Governor, where is your mask?" And he said, "That's my choice." She said, "Read the room. You see everybody with a mask on." So it's like, it depends on, like you're saying, the community. But I believe as long as you have a mask on, whether somebody else have it on or not, I don't worry about them anymore, Michelle.
Oh no, I wasn't worried about them, Miss Christie. I was just uncomfortable because it's different when it's, 2 or 3 people in your cipher, but this was a whole grocery store, a shopper, people, because they're trying to get ready for a snowstorm. So there were more people shopping.
You do know that's why their hospital systems are all overloaded.
Oh yeah, I didn't even inquire because I didn't want to know. There were so many COVID patients coming in the clinic that I didn't even care really about their hospitals. But the people who were just, it was just a culture shock for me, and I was nervous. I was like, just don't touch me, because this is not a good look at all.
Right. They're not wearing masks, and
because they're not right. No one's wearing a mask. Like what? What? Right? Is this Mars?
You were in
Trump's land. You were in Trump land.
Realistically, this is happening everywhere.
Mm-hmm.
And so, when I was in Houston, 9 of my friends were infected. I didn't care what they did.
Mm-hmm.
I continued to do what I was supposed to do, and I came back with nothing. So I'm just,
Miss Shirley, you didn't act. They were your girlfriends. So did you say something like, "Girl, where's your mask"?
No.
Okay.
2 ladies that I met with on the first day called me 2 days later and say, "Oh, Shirley, I have something to share. I just found out I'm positive."
Mm.
But it still didn't affect me because I had my air cane, I had my mini purifier, and I had my air tamer.
Mm-hmm.
And so I'm convinced, because it's worked before, that if I continue to do what I'm supposed to do, I can live with the consequences because I'm doing everything that I know to do. And they're walking in without masks.
So did you see,
Amen, Miss Shirley.
did you go see them?
No, we met at restaurants.
Okay.
Yeah.
And you best believe she had everything with her.
I had everything with me. Every time I went. So
Okay.
I just,
So Miss Shirley, did you turn the air cave on and your air purifier?
yes,
So you would have both of them going at the same time.
right.
Okay. Okay.
Especially there because I knew that most of the buildings had face masks recommended, but not required. And so
Okay.
because it was warm, it was 80s, you know, I just think that when you're in an environment where people have decided they're going to pretend that it's over, they're going to do what they want to do.
They pretend.
That's what they're doing, is pretending, because it's not like anyone's told them that.
Well, they are in a state of denial, because that's what I was asking Dr. Bless, but I'm like, is it something psychologically going on? Because a lot of them are in denial. Any way that you look at it, it's nothing but denial.
I agree. And I didn't even, you know, go in and say, this is this and this is that. I just sat down, put my little stuff down. And maybe one or two people would ask, but the majority of them went on with what they do all the time.
Mm.
And the one thing that I notice is when people get through eating, they don't put their mask back on.
Mm-hmm.
See, and I do, but I had my tamer, I had my air cave and my little mini purifier.
That's protection.
That is protection. Very
Well,
good, Miss Shirley. Very good.
I'm sure they were talking about me behind my back because one girl did say,
Cares?
oh, here she
Who
comes with
cares?
all that apparatus. And I
Who
thought,
cares?
yeah, so you probably want to sit down here with me, right? You know, just
Miss Shirley, you still gonna be alive, and that girl can have COVID and be fighting for her life.
exactly.
Okay.
I have a story to tell y'all in my own family. My first cousin that my mother raised used to send me all kinds of crazy stuff, but the vaccine was the devil. And I told her to stop sending me that crap. And last year, she was in the hospital in New Jersey with COVID and pneumonia in ICU for 11 days.
Oh, Lord.
And she could have prevented all of that because I told her to stop listening to false prophets. I gave her all the information that we share here, and I shared it to her. And this is my thing. People that are scientists, God gives those people knowledge, the scientists and doctors, to help her invent stuff to protect us. It is up to us to use it. We have to use common sense.
Right.
Ooh, that's for true.
And her whole family had COVID and pneumonia. How about that? But she ended up in the ICU for 11 days.
Oh, well, how is she doing now? And what is she doing? Because you don't want to get COVID more than, you want to try to not get it.
She will
Only
not
don't
tell the rest
get it.
of us, Dr. Blessman. I've been trying to ask, but she will not tell the rest of us whether she's going to get the vaccine or not, because we were trying to encourage her to do that. Like, I was able to convince my older cousin, her brother, he didn't have COVID, he wore his mask, but she works in a school. And, you know, she will not share that with us, that whether or not she's going to get it. But I have told her, and I told her from day one, that she needed to get the vaccine and make sure she always wears a mask and continue hand washing protocols.
No, as I've said before, you've heard me say this. I have a couple of friends that are unvaccinated for a reason, one, because her body system is just really fragile.
Right.
But she is so on it when it comes to the biosafety protocols. she religiously follows them. And then I told you about my friend Charlie, who has the blood cancer that he's immunocompromised and the vaccines don't take. He doesn't produce antibodies from the vaccines. And he too is also very, very, stringent, really religiously follows the safety protocols. So you got to do one or the other. And preferably, some of us are doing both, vaccine and being stringent about the protocol.
Right.
So I'm
Exactly.
even though they say most of us will get COVID, I'm trying to be the one that don't.
Mhm.
I am too. We are going to be those outliers because that's not true. I'm like Michelle. I do not believe that. I believe if we follow our biosafety protocol and do what we're supposed to do, I believe we will be fine and we will be the outliers. We will not catch COVID.
Now, now I can't control everything. That being said, I can't control everything. I have a son who is not, he doesn't really, I think I mentioned that he went to school one day. Although he has an ionizer, he didn't take it. He had lunch. He took his mask off and he ate without his ionizer on. He could have brought us back home.
Right.
Some things I can't control. But the things that I'm doing everything that I know how to do. And, and hopefully if it does touch me, hopefully I won't get like a huge viral load up, so, but I'm trying to be one of the ones that don't get it, And even if I were to get it, because I don't want anybody to get in shaming people, because people have said that, I felt so ashamed. People made me feel so ashamed about getting COVID. We're not going there. Because there are things that are outside of your control where you might end up.
Right.
Exactly.
But as long as you do the best that you can do, hopefully, you won't get a large viral load. Hopefully, you won't get a knockout punch with it. You'll just get a little bit that your body can handle.
Can fight it off.
And
Exactly.
this is the follow-up. Like Miss Shirley told me about how to go to LabCorp and get my antibodies tested. So when I had my booster, because I told y'all before when I had J&J, my antibodies were like little of none. But I did go to LabCorp, and insurance pays like for everything about COVID. Now my insurance pays for everything. And I had a good level after my booster shot.
All right.
So I did not do Johnson & Johnson. I did Moderna
Okay.
when I got the booster.
Did you said you went to lab what?
LabCorp.
That's the one we went to, Todd.
Yes, LAB.
Yep, Miss Shirley, you sent me there, and I did. I requested it through my doctor, so I appreciate it. It worked out.
Perfect.
Can
That's
I ask
awesome.
Yes.
I'd like to ask a question. I know that Dr. Rollins, had said that he hadn't been vaccinated. This might be personal, but did he ever get vaccinated? I mean, since he have the COVID now, or do you guys know anything about that, or how's?
He said he was waiting for Novavax. So Novavax just applied for the emergency use authorization this month, and it may be a month. It might be like sometime in March before we know whether it's going to be approved for use authorization or not.
Oh, okay. How's he doing?
He's having some residual lung effects. It really set him down for a minute. I mean, more than
And he looked like he had lost a lot of
he
muscle.
lost
Yeah,
weight. Yeah.
Well, did he get it from someone, or he, in his practice, or he didn't really say, or
He didn't know.
He didn't
It's
know.
so hard to tell with that. He travels a lot.
Yeah. So he didn't go into detail about where it was. What he did say, or what he has said, is he recognizes that there are he gets this when he's around important people or people that he's impressed by, that sometimes he doesn't keep his guard up. He thinks that might have been first of all, it took him a long time to even say that he was sick.
Yeah.
You read between the lines or listen between the lines. he didn't really want to tell people that he was sick. So finally he came clean and told people that he had gotten COVID. And he saw that, you know, like I can talk about this from another perspective now as a person who has survived COVID and survived it. So, you know, because, you know, here he is, you know, the COVID, you know, warrior, and he got COVID, you know. But you know, he is a human being. You know, I'm a human being too.
Yeah.
You know, I mean, I hope to heck I can keep up. You know, you all encourage me, and this group, this process has been encouraging to me to like stay vigilant and on it. And you know, and we talk about situational awareness, you know, and being careful around situational awareness is not just making sure that you're aware of what are the high touch, or high touch areas in a place that you're going to, or how many people are in the room or the space in which you're at. It's also knowing yourself a bit and what are the conditions under which you might let your guard down. You know, Miss Antoinette talked about, who is, you know, my friend who is unvaccinated. She has lupus. She didn't want to get vaccinated until it was proven safe for people with lupus, but she follows the biosafety protocols religiously. She ended up having her grandchildren through Child Protective Services. She didn't want her kids to go into the system, so she took her grandchildren and you know, her daughter's running around doing stuff, right? So she took her grandchildren in. They started crying in the middle of the night. She forgot to put her mask on. She went in and started taking care of the baby. And then, you know, in that moment, and that's probably where she got COVID, in that moment. And the kids were sick too, you know, at some point. So, you know, people can be like, say, if you were at a funeral, say you know, I saw people at funerals where, you know, their loved one is sick, you know, I mean, has died, and people are coming up to them and they didn't think through that they might need to put their mask on when they're doing part of the receiving line, or, you know, or wear an ionizer if they don't want to, you know, and if you hugging hundreds of people at a funeral, you're likely to come in contact with somebody that might be positive for COVID. So there might be times when, you know, it's important to just think through, you know, occasions when people, where you might be in a situation where you might let your guard down. I can tell you for a fact that I have not been to a funeral yet where somebody had printed COVID protocols in place as part of the planning for the funeral service. Now, I'm planning a memorial service with my husband for his father this summer, and we will have protocols. And we will get his father was like 92. So everybody that he knows, all of his fans are in their 80s or 90s. So we get ionizers for everybody, because they're going to want to hug and talk, and they don't want to put their mask on because they're older. Older people take their mask down so they can talk to people, you know, so they can hear, you know, or whatever. And they're, you know, and they put their faces together so they can talk to each other. So they need to have ionizers. But people don't think about that when they're planning a funeral. You know, what can I say?
And I just was gonna say, just listening to all the news today and different people speaking, because some of the governors are coming out saying they're gonna drop the mask mandates in certain places. And they're basing that on the numbers diminishing. And I'm like, well, maybe the numbers are diminishing because you have a mask mandate in place. But also, maybe the numbers are diminishing because people are doing home testing and those numbers aren't being counted. There's many reasons why things are not being counted in the numbers. Plus, they're saying that the stealth Omicron is not detected by testing. So we're constantly passing it around, passing it around, passing it around. And I've talked to several teachers, and they're like, the kids could be at home or learning virtually because they're not learning anything anyway, because they got a different set of students every week because somebody is out. Either the faculty is out, still getting sick. Nobody can ever get well because they're constantly passing it around because people aren't doing the mask. And here in my state in Tennessee, our ding dong governor has a you can't mandate wearing masks. So at the university where I work, they said, and I'm working from home, I never went back. So they say if somebody comes in your office, you cannot make them put on a mask. Everything is highly recommended, but you cannot make anyone put on a mask.
Yeah, that's how
So
my
you have a room- you
son-in-law
have
worked at the. I'm sorry.
What'd you say?
You have a
I-
room purifier and an ionizer, right?
Yeah, my son-in-law is a teacher there at MS College here in Tennessee, and first quarter, everybody had to wear a mask, the teachers and the students. Now it's like this lady just got through saying, you just have to, if you want to wear it, fine. If you don't, that's okay. So they're just really being, just really being lifted.
I will be wearing my mask and using my protocols until they have a treatment for COVID.
Okay.
Amen. Amen.
A cure.
I would probably be wearing mine afterwards.
Shirley, I'm with you. I'm going to continue to wear mine because I do not trust other people. People lie all the time and know that they have COVID and will come around others and spread it. So you have to have your guard up, and I know instances of that. You have to have your guard up all the time. You cannot drop your guard for anything. You have to be on your P's and Q's. This is a matter of your life and your in depth.
And all the decisions are being made economically. It's not about public health at all anymore. Everything's about the economy. And I don't know if y'all spoke about it because I got on a little late. The healthcare system is just hanging by a thread. There, I don't know if y'all saw on 60 Minutes on Sunday, they had nurses on, and they were just talking about how many people are just leaving the field like in floods. And they say the healthcare field was made up of 53% nurses, and they're losing nurses like left and right. And also, people aren't thinking about the long-term effects of COVID. Even if they have a mild case, they're still experiencing long-term problems with it.
But all that would be a reason why I wouldn't want to have it, because even if you got sick and had to go to the hospital, if the percentage of nurses is down, well, who's going to take care of you?
Exactly. And that's what's happening. The one nurse was talking about, and their mental health is at risk, and that's why so many of them are quitting. They said after you see so much death, and things just and people coming in, and because of the visitation policies and all of that, all of it combined, they said it's just getting to be too much. They don't seem like they're cared about. They don't have proper PPE in a lot of cases still. And then now that they can go back to work in 5 days without retesting or anything, they could still be spreading COVID, but they're made to go back because they don't have enough people.
Correct.
Shedding the virus. This has been like some really, 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 really rich conversation. I love when the community gets involved and share their stories. We can go on and on and on. And yes, Ms. Wright, the system is collapsing around us. And people we don't feel it because, okay, number one, you're not sick. You don't have to go get, I don't know if anyone in our community goes to get dialysis, 3 times a week, or you are going to the doctor because you have early stages of cancer. So the only way that you really can see that the hospital system is collapsing around us is if you are either a healthcare worker, you're working in that environment, or you are a patient not being serviced.
Or you have friends who are in the healthcare industry.
Right. And can see it.
My little cousin is
Mhm.
here. She's a traveling nurse. She came in from South Carolina to be at a hospital in the north suburbs here in Chicago. I've got a friend who's a VP at Lurie's Children's Hospital here at Northwestern, and then another friend that I mentioned. The Atlantic article is in the chat, but they talked. She's head of nursing at Advocate Healthcare, and that article that was posted in the Atlantic. Dr. Gwen Oglesby Odom is her name. She's heavily quoted in that article, but it gives a very thorough description about what's going on in some of these hospitals in these communities, especially during a time when there's a surge, a huge surge. So, some of us may be having friends or relatives, colleagues that we're close to. And, every day I'm hearing the stories about, I won't say every day, but I'm hearing the stories about what's going on in hospital systems and what's happening and the collapse of it. And when, I talked to Gwen quite a bit, but the article in the Atlantic, and I'm going to check out the, you just mentioned it, comes on Sunday.
60 minutes.
60 minutes.
Because I think we need to have, a visual reminder or some kind of reminder that, this is real. And you do not want to get sick with this and end up in a hospital, because if your hospital is, you want to have access to good care. Now understand that there are going to be periods and times during the year where you really going to have to, where your biosafety protocols are really going to have to be on point. And that's during the holiday season. So understand some of the reason why the numbers are going down right now is because the holidays are over. So it takes about 30 to 40 days after the holidays to see the death rate to start falling. And we really don't know what the infection rate is because, like, as somebody mentioned, Omicron is not easily detectable in the antigen test. So we think the infection rates are falling, but it's really, if we want to see what
Dr. Blessman, we don't know about any numbers because as far as data, we are not collecting accurate data. We're not collecting enough data and the right data to help teach the scientists what they need to know. And that's part of the bigger problem here. It's like people are so worried about what money they're gonna make, and we don't even have, everybody should be getting a PCR test that comes down with COVID. We're not doing that in America.
Well, they already said that this new strain, you'll need to be nosed, swabbed, and a
PCR test
culture, because they're not in it. It has to have the antigen because it's evading so much that it's not coming up on these little home tests and stuff that we have. So, everything is just
testing, and we don't have it, Michelle. We just don't have it.
We just don't have it. So,
and what are we doing to get it? What are
nothing,
our politicians doing to get that kind of stuff for us? That's what people need to be focusing on.
And I heard that, I think he was an FDA commissioner today. I heard him say something that was just so asinine to me. And it seems like that's how they're making their decisions, just based on how people feel, what they're tired of, and all of that. And he was on in response to, these governors saying that they're gonna, undo their mask mandates. And he said, everybody's wanting to get back to normal, and everybody's wanting to know when we can turn this thing off. So I think the governors are making a decision. Well, you don't get to decide when it's turned off. The virus decides when it's turned off. And I mean, whether you can say you've turned it off, but the reality is that it's still there, and us acting like it's not is doing us more harm than good.
Exactly.
But the virus can turn them off because the virus can put them 6 below and turn them on off.
Mm-hmm. And it is. I mean, we just had one person from the alternate Earth. You know, they made a big deal out of him because he was on Fox News saying how he saved the day because he quit his job because it was mandated to be vaccinated, a police officer. And today he is 6 feet under, right? And Fox News has not given any condolences to his family or has even mentioned this man's name. So we know that there's an alternate universe in our country. I mean, I think that this virus is just only but you know, so many other bad things are happening, right? That we, you know, we don't want to, that we can be distracted, right? So while we are trying to figure out how to navigate a pandemic, our voting rights are being trampled on, and that's not our platform. But we just have to stay. So what I'm saying is, with being tired of this this virus, right? So we have to come to the conclusion that this virus is not going anywhere. My mother says she will be wearing a mask for the rest of her life, and I think that I will be too, unless we get a treatment that will kill this virus. And it's not there, and it's not in the, I don't see it in the forthcoming future. With that being said, practicing our biosafety protocols daily. I think that if you add a protocol, right? So we all have things that we do in our own home with our products, whether it's the Clean Smart, the CHOL, whether you're using a Living Guard mask or an N95. If you're not taking your shoes off at the door, then maybe that's something that you could probably add to the list, right? Let me make sure that I'm taking my shoes off at the door, and I'm making anyone else who comes into my home take their shoes off. When I go into someone's home, I immediately take my shoes off at the door. I can't always say that for my own house, but I can say that when I'm visiting, and it's not very often that I do get a chance to visit. But we will recognize and admit that there is some fatigue in this season. But I think that we will stay the course on talking about how we can take care of ourselves while we are going through a very public outbreak of COVID-19. Before we end our platform, I want to ask that if you need any product, the Skin Guard, there is a link. Justin tested the link at the beginning of the show, and he said the link works. So if you need any Skin Guard, put it in the chat, and I'm gonna call on Justin to help me make sure that we can get the information that you need. The Living Guard masks are still available. The air caves. If you have not invested in an air cave, you need to invest in an air cave. Even if you have half of the unit, you need to get that air cave. It works. If you have, and there is a discount. Justin, if you can put the discounts in the chat for me, please. There is a discount on the air cave. There are discounts on the Living Guard as well as the Skin Guard. But you want to make the Skin Guard part of your hand sanitizing regimen because the product does, it works. And I think Dr. Blessman,
Can I ask?
that's all I
Can I?
have.
Can
Wait
I
a minute,
ask
there's
one
somebody
question?
that want,
Can I?
yes.
Can I tell you something? A friend of mine's grandson was at a party, I guess it's during Christmas time, and I don't know. All of a sudden, he saw this thing that come up on his computer that says COVID. A guy just walked in, and the guy must have had COVID, but his app or whatever COVID app. Have you heard that before?
Yes, yes.
Okay. Well, I just wondered about that because I never heard about that, and so I just wonder if that's true or is it accurate or what do you think about that?
It is accurate. I use it all the time.
Really?
It comes up on my phone. I have it downloaded. And if you're around people that are exposure, and it gives me the exposure rate in my area that I live in every week.
Because that young man said, "Oh, Mom, we got to leave." Somebody came in, that man came in with COVID, so they had to leave in a hurry. So
I want to
yeah.
check that out. Can you put it in the chat, please?
Yes, ma'am.
What's the
Okay,
name of it?
It's an
Thank
app. You
you.
can go to your phone, Dr. Blessman. It's like a tracer, a COVID tracer. Yeah.
It's called COVID Wise.
Mhm.
COVID wise.
That's one. It's a few of them out there.
A few of them.
Yeah.
Okay.
That's the name of the app, right?
That's one of them. Yeah. But
You
if
have
you
an
go into
Android
your smartphone, yeah,
Android or iPhone?
both. In your Play Store.
No, the one, the COVID Wise, was that a Android or an
That's an iPhone.
Okay, great.
Well, can I just share some information, if you don't mind? This is Renee. I know you were talking about having our gear, a dress for battle. That's what I call a dress for battle. So I do have my skin guard and all that stuff and ear cave. But at one time we were talking about the home medic, and so I don't know if you had the home medic on your site, but can I share that Costco actually has the home medic, the 5-in-1 ear purifier. They have the big one that now it went down. It's $139, and I think it's to the end of this month. Don't quote me, but if you're interested, it's my cousin aunt told me about it.
Mm-hmm. Yeah, I like having a air purifier in my home. The dust is down. I didn't realize that until Shirley pointed that out. I don't have to dust as much. And so, oh yeah, you're right. I don't have to dust as much. But it also helps with, I live in an apartment building, a high rise. And so, during the winter, of course, we can't open up the windows. So it's kind of nice to be able to have fresh air and clean, our air being clean while we're here. But, it's also important because I live with a husband and a son, and I can't control their actions per se, but, I have some way of being able to reduce the potential contaminants in our air should one of them, not get lax in their protocols and come back with COVID.
Right.
I got protection.
Do you keep it on all the time?
I keep it on all the time. Yeah, I just
It has a UV, it has an iodine, all that in it. So I've bought a couple for my family. So you recommend that?
Yeah, Homedics has a good one.
Okay.
Molecule has a good one. Anything, I'm not into, you choose based on your aesthetic and, your pocketbook. But as long as it's, right for your place, and I prefer the ones that actually kill COVID. So,
So no, I need clarification because they're saying this kills COVID. So I want to make sure. So they have the 2-point microgram that does kill the COVID. So I want to make sure.
If it has UVC,
it has the UVC, it has iodine, it has a 2.3 mic. Yeah, it has that in it.
And at least a 13 HEPA rating.
Or 2 point, is it a 2 point that?
The filter needs to be a 13 HEPA, true HEPA or MERV rating of 13 or HEPA 13.
It is. And what's the other one? There's a 2 point something. Can't think now. Oh, my line, help me out. They know it's something. I think it's 2 point microgram or something. You got to have at least that.
It has to be able to filter down to at least 0.3.
So it does have it. So it actually has that.
And the UVC is what kills the COVID.
So it has a UV ionized and it's down to the 0.2, so it does have that.
Okay. So
UVC, what do you say at the UVC of a 2.3?
UVC,
Uh-huh.
and then it needs to be able to filter down to 0.3, so which means microns, which means it needs to have a HEPA filter that has at least a HEPA 13 or MERV 13 rating. So I don't know what kind of filter, in terms of the filter. So I don't know what kind of filter is in that specific. So look at the
I know
filter.
it's 2 point. I know it has a 2 point. It definitely has that.
Yeah. I don't know. You said it's on Amazon?
No, Costco has it for $139.
Okay, you know what? It's, you know, that's a well, yeah, check what kind of filter they have on there. They should be, if it's not telling you that it's a MERV 13 or a HEPA 13, then, you know, I don't know.
Okay.
HEPA 13.
Yeah, it does. Yeah.
It does. You have to have a HEPA 13. That's one that's required.
Yeah, because that one we know, HEPA 13 or better, we know filters down to 0.3 microns.
Okay.
So it will capture, kill the viral particles.
Okay.
I don't know why I thought we talked about this one time before.
We have. It was a while
why-
ago. We did a whole series on being a savvy.
That's why I bought it, yeah.
Mhm. And then, of course, it's UVC. So it can't be UVA or UVB. It's got to be UVC light. that kills.
UVC. Okay.
And then the third thing is what size space is it made for? Because you want it to refresh the air pretty regular shower.
For what now?
You want it, what size room is it made for?
Okay.
Because remember, it's trying to clean all of the air in that room, and you want all the air to cycle through that that routine pretty quickly.
So, you know, it says it has a 360 HEPA type filter, removes up to 99% of airborne, and it's 0.3 microns.
It says 0.3 microns?
Yep. The HEPA is 360 HEPA type filter, removes up to 99% of airborne, as small as 0.3 microns.
There you go. That's what you need to see. Okay.
Okay.
And it was
Okay.
139. And I got one more question. I've heard that there's some type of a new cryptic SARS virus brewing in New York City. Called the N1 something, 1, 2, 3, and 4. And they find it in the sewer system. Anybody hear anything about that?
Heard of that.
It's found in the sewer system in New York City, found that, you know, the rats and the cats, and you know, they haven't found any humans yet, but they found it in the sewer system, and it's
and
really
what is
getting bad. It's called, like, I think it's a cryptic I think YPTIC, don't get me right, SARS COVID virus, and they call it the New York N1, 2, 3, 4, and cryptic meaning mysterious. So they found it in New York. You can look it up. You can Google a cryptic in New York City sewers, and it'll come up.
Here it is.
You saw it, Michelle?
Yeah, I got it.
Well, we all, you know, we keep saying this, you know, this is not done with us.
I also wanted to ask about that oxygen. While we were on the phone, I called this oxygen company.
Oh, here it is. Mystery lineages of coronaviruses are popping up in New York sewage. Okay, I guess we got topics for next week. You know?
Go. Thank you.
Well, you know, we have, that is one of the ways in which, you know, Dr. Rowland talked about that. You said one of the ways that we can find out if the virus is gone is you sewer systems. And if it's no longer in sewer systems, then the virus is gone. So
Mm, mm, mm.
Well, while we were on the call, I looked up, I was calling somebody about the oxygen, and I got a hold of this company. It's in Colorado, but they serve all over. It's called LPT.
Mhm.
And this particular guy, I just listened to what he said. He said that, you really, most time you need a prescription really to get the oxygen full. He said the stuff you buy in the store, it's just those little portable things that'll take last you for a couple of breaths, nothing long. He said, but they have something that where you just plug this in and it circulates the oxygen in your house and you don't have to buy the oxygen. He said, but they can be very expensive, but you have to have an order or you could have a business. So anyone that has a business, Mary Kay business company, and can show that to them, then they can get it and that person can get it for you. So I just want to throw that out there. I could give you a phone number that he gave me. That's all I have. He said they send it everywhere, but I guess we would have to check it out. I'll give it to you if you like it. It's 800-946-1201. And again, that's 800-946-1201. His name is Mickey.
What's the name of the company, Renee?
LPT. So of course, I know you're going to check it out. Thank you, because people tell you so, but it's called LPT. But he said if you don't have a prescription, if you have a business, you can get it. He also mentioned welders have an opportunity to get oxygen. So, if you find a place where welders get the oxygen tanks full, then that might be another way. He said, but normally it's a certain type of oxygen that you get. So, if you want to get the right kind of oxygen, you want to make sure you're using it right. The little portable tanks you get is only for a couple of breaths. They don't last long, but I don't know much about it, but I just wanted to share that.
And what welders use, it's not pure O2.
And none of this stuff that we're buying, he's saying it's not really pure. He says it's just something, that's just temporary. It's not really pure without a prescription. So I don't know how true that is, but again, he said you really need a prescription because you don't just get it. You'll find places that will sell it, but it's not the actual pure oxygen.
Dr. Blessing.
Well, yeah, this is a good topic for next week. It's 9:15, y'all.
I love y'all. Y'all hook us up.
Well, another thing we need to touch on too is the.
I'm so grateful. Thank you, everyone. Let's save some of this for next week. We're gonna look up the mysterious. We're gonna get more information about the mysterious lineage of the coronavirus that's popped up in New York City, and testing wastewater, how they use that to track coronavirus, track COVID.
And you can also add to that how in China they are using some type of suppository to determine whether the people have Omicron. So they're getting it
right.
They're testing the rectum.
Yeah.
Lord, I hope we don't get to that.
Well, they said that this article I just read said that, you start shedding the virus in the fecal matter before you even start sick.
It makes sense.
Okay.
So anyway, it's 9:17, folks. My child is here. He's saying, Mom, I've given you 17 minutes more.
You gotta get off.
Over here.